Hi everyone, Rani here. A very quick tutorial what to do when someone is either starting medication or stopping medication. I'm going to use the 3 P's to illustrate 3 points to remember. This information is useful not just for prescribers, patients or clients, but also for therapists, counselors and anyone who's supporting someone with mental health issues. I have seen things go wrong because people are not following these 3 P's and they're rushing to start medication or stop medications. So what are the 3 P's? There are obviously lots of other things that you need to consider, but these are the main principles. The first P, when we are considering starting medication or someone is wanting to start medication, is to pause. Okay, have I explored other options? Because most people will say that yes, I easily started the medication, but when it came to stopping, it was extremely hard. So pause for a minute. It might well be that you do need medication, but have you explored other options? And have you, as a prescriber, explored other options for this person? The second P is patience. Now some people come to me and say, but I have tried everything and it doesn't work. And when you dig into it and say, how long have you tried? Most of the time it's just for a couple of days or maybe a week or so of trying to eat healthily or trying to do exercise, to saying it doesn't work. So I would say that if you're exploring options and you know there is an evidence base for it, have patience and follow it through, doing everything you can in order to give that a good chance. The final P is plan. Okay, you might say that, yes, I have tried this and I have been patient and I have explored. Nothing seems to work and I really need to start on medication. You need to ensure you have all the information about the medication you're about to start. You need to know why they have been prescribed to you, how they work, the benefits, the side effects, and also the risk of withdrawal symptoms. And also, how long would I need to be on the medication for? You need to ask your doctor. And if this is something like for the rest of your life, you need to challenge that. So those were the 3 P's for starting medication. Planning is the first P. Most people say, right, this medication is not working, so I'm just going to stop it. Or I had enough of this medication. It worked for me, but I don't need it anymore, so I'm going to stop it. Very, very important to plan how you're going to go about it. Important to discuss that with your prescriber. Mostly I say to people that if there are some life events going on, best not to make those medication changes or try to taper it then. It has to be like, have you got the right support? Is it a right time for you? Do you have a plan as to how often you'll be monitored? And obviously follow the Royal College guidelines for stopping antidepressants. Please do not stop medication abruptly. Even if you think that you are doing it very gradually, like over a few weeks, it might not be gradual enough. So it depends on how long you have been on it and what dose you have been on. Not everyone has withdrawal symptoms, but people do have, they can also go on to have what we call protracted withdrawal symptoms. The second P is then patience. It's very important to slow down when it comes to reducing medication. Reducing the dose of the medication as per the Royal College guidelines might seem very slow. A small dose reduction every 4 to 6 weeks. You might have the urge to do it faster or stop abruptly after the initial few times because you think you'll be fine. Please don't do that. There's enough evidence to suggest that the risk of withdrawal symptoms are significantly higher if medication is tapered at a faster pace. Now let's move on to the final P, pause. How am I doing? How is the patient doing? Is it important to pause here for some time so that they can just get used to this lower dose of medication before the next drop in medication? So this was a very quick video. Anytime you want to start or stop psychiatric medications, remember these 3 P's. Pause, be patient, and plan ahead. Remember, this is not medical advice, but an educational video. But I hope you enjoyed it. Let me know your thoughts.